Hi, Assalamualaikum and good evening everyone. We are from Group 1 are going to present our infographic poster which is the detection of breast cancer with NMR spectroscopy from tissue samples. My group members are Iza, me, Aida, Afnan and Najwa. Okay, firstly we need to know the fact about the breast cancer. The breast cancer occur almost entirely in women. 99% of breast cancer occur in women. This means that breast cancer in men is very rare. And then it is the second leading cause of cancer-related death. The second one is the lung cancer, and the family history increases the risk. The introduction, the ductal carcinoma in situ is the other name for the breast cancer, present of abnormal cell inside a milk duct in the breast. It can be considered as the earliest form of breast cancer. Ductal means that the cancer starts inside the milk ducts. Carcinoma refer to any cancer that begins in the skin or other tissues. DCIS is called a non-invasive because it hasn't spread beyond the milk duct into any normal surrounding breast tissues. Next is the symptoms or sign of breast cancer. Firstly, we can observe around the breast, it contains lumps, and then the nipple discharge, dimpling, breast or nipple pain, nipple interaction or inversion, and then the redness around the breast, the changes of the skin texture, and then the swelling.
Okay, so now I will continue on how a sample preparation for breast cancer detection is done. Breast sample cancer detection is done by using a vacuum-assisted breast biopsy, which is one of the latest method in tissue biopsy. So what makes this method differs from other method is the use of vacuum, which is connected to the needle tube to suck out the targeted tissue inside the breast, and the use of MRI or mammography instrument as a guidance to detect abnormal area inside the breast and to ensure the correct position of the needle tube when extracting the tissue inside the breast. So after the tissue has been collected, the sample will undergo a few chemical procedures such as formalin fixation, processing, and also staining in order to preserve the sample from degradation, and lastly will be sent to the lab for analysis under microscope and confirmation of the metabolites inside the cancer tumor cell using NMR analysis.
Okay, thank you, Iza. Okay, for the analysis, tissue samples were analyzed by proton NMR because of high sensitivity, and almost all compounds contain proton in biological tissues. Proton NMR is the most widely used method to differentiate metabolism between tumor tissue and normal tissue instead of carbon-13 or metabolites in cancer have been reviewed as biomarkers for the diagnosis so that patients can receive specific treatment options. Next, NMR spectroscopy combined with pattern recognition technique is a helpful tool in a tumor metabolic profiling, as it has the potential to obtain comprehensive characteristics and pathways between tumor tissues and healthy tissues. Percent sensitivity and 79.3% specificity were higher concentrations of 3-hydroxybutyrate and acetyl glycoproteins, pyruvate, glutamate, and low concentration of histidine, alanine, and betaine metabolites were observed.
So now I will be talking about the result and finding of NMR spectrum analysis of breast cancer tissue. So the first one is that the concentration of glycerol phosphocholine and also choline in larger tumor that is bigger than 2 cm is higher than the smaller tumor. So this finding indicate the cancer stages of the breast cancer patient. So the next finding is where there are 9 significant metabolites that are found in breast cancer tissue, which are beta-glucose, lactate, glycine, myoinositol, taurine, GPC, PC, choline, and also creatine. So the third one is that over 55% from 257 samples that the recurrence were detected by observing the concentration level of the estrogen and the progesterone. So as we all know, breast cancer is globally known as the highest malignant disease in women. So the reoccurrence rate is very high. So NMR spectroscopy is helpful in this result finding that more than 3/4 of them can achieve high survival rate from the early diagnosis.
Okay, what we can conclude here are normal adjacent tissues is clearly different from the tumor tissue. The proton NMR is the most widely used method to differentiate metabolism between the tumor and also the normal tissues. Thirdly, although the magnetic resonance is an excellent tool for early detection of breast cancer, the breast MRI screening is at least 10 times quite expensive and it generates higher associated diagnosis cost. And then last one, based on the sampling method, this is more recommended as compared to various breast tissue biopsy due to its higher accuracy, less invasive, and higher amount of tissue can be collected. So that's all from our group. Thank you.